Hi, I'm Jania from Nevada State College, and I'm here to do a newborn assessment. My baby has just been born, so the first thing we want to do is dry the baby off because we need to make sure that that baby stays warm because the baby is adjusting to the outside of uterus and adjusting to a new life. Okay, so this baby is crying really hard, which is a great sign. So the first thing we need to do within the first minute of the baby being born is doing an ABCAR score. So the first thing that we note that the baby is crying, so that is going to be a score of 2 because that counts for her good respirations. Okay, so then the heart rate is taken, and a heart rate of 130 is what this baby has, and if it's over 100, then that's good. We're going to give her a score of 2, and then we also are going to assess the muscle tone and flexion, and as the baby's crying, we just give her a little flip here with the arms, and they go right back, they flex. That's really good. That's a score of 2. Okay, then we have, the baby has slowed down on her crying, but I'm going to have to give her a little pinch because that's going to make her cry some more, and that's going to make sure that we see that she has reflex irritability. So that's a score of 2. Then finally we have her color, and we look at her color, and everything looks good, except she does have a little bit of blue here on her extremities, which is totally normal. That is called acrocyanosis. Okay, so her total score would be a 9. So 9 is great, and that means that she's not in any fetal distress. Okay, after I've done that, then the baby has calmed down a little bit. We're going to weigh the baby, and the baby is on a zeroed scale balanced, and she weighs 3,410 grams, which is 7 pounds 5 ounces, which is in normal range. Perfect average weight. Okay, the next thing we need to do is take the baby's measurement from her crown of her head to the heel of her foot. So we measure that, and it comes to 49 centimeters, which is in range. The range should be between 45 and 55 centimeters. Okay, so we're going to be recording these numbers as we take them, and then we'll be documenting. Okay, so we also want to make sure that the baby has an identification bracelet or anklet, and that will be the same as her mother's. Okay, so the next thing we want to do is do our vital signs for the baby. Okay, so the vital signs in the hospital are done every 30 minutes for the first, or at least for the first hour. So we're going to count our respirations, and this baby will count for a whole minute, and this baby's respirations are, say, 40 per minute, which is in the normal range of 30 to 60 per minute. Now, if the baby has any apnea, that is perfectly normal as long as it doesn't exceed 15 seconds, okay? So the next thing we would do is the heart rate, and we will be assessing the heart rate by auscultating. Okay, the baby's heart rate will be auscultated for 1 full minute at the mid-clavicular line and 4th intercostal space. So the baby has a heart rate of 130 a minute, which is in range. And that should be between 100 to 160, or depending on your references, 80 to 180. So while I'm here and I have my stethoscope, I'll go ahead and listen to the baby's lungs. So we want the anterior and posterior side auscultated. All right, so there's no crackles, there's no wheezes noted, there's no grunting or signs of respiratory distress, so this is good. The next thing we want to do is our baby's blood pressure. So there could be an automated machine, or you could do this by hand if you had a small one. You could do it on any of the extremities. And the blood pressure for this baby is 66/46, which is within normal limits. Now, if this baby if we detected any kind of cardiac issues, then we could take the blood pressure in any of the 4 extremities just to make sure everything's okay. Next thing we would do is the axillary temperature. So this is cleaned and placed underneath the armpit and held And then after this beeps, we have 37 degrees Celsius, which is perfect because that is 98.6. Okay, perfect. So we would be noting these things and then documenting. And now we need to start assessing the baby's measurements. So the head circumference needs to be measured. So this is going to be done in centimeters at the crown of the head here. Okay. So we have 35 centimeters, which is 13¼ inch, which is perfect range. Okay, so that normal range for that would be 32 to 36 centimeters. So then we want to measure the circumference of the baby's chest. So we measure around at the nipple line. So when we measure that, that's okay if it's 2 centimeters smaller than the head. This baby, it's perfect because she is 33 centimeters. Okay, so now that I've done that, I'll be measuring. I will note the baby is not resisted to any extension of the extremities. So that's a good thing. She's got good range of motion. So then we're going to look at her skin. So her skin is dry, soft, smooth, and intact. I note that I haven't mentioned before that there is some cyanosis there, acrocyanosis on her feet and hands. That's fine. So there is also a little bit of milia here on her nose, which is fine. That should take care of itself within time. The baby is not jaundiced. That's a great thing too. So then I'm going to assess the skin turgor, and I can do that by giving a little pinch, the clavicle over here, and I show that that is, the skin springs back, so that is good. There's no dehydration. I also note on the back of the baby, make sure everything looks good here, and there are no birthmarks. Okay, so now I'm going to be looking at the baby's head. Okay, so the first thing I'm going to do is notice that it is round and it looks symmetrical. Now, I'm palpating the anterior fontanelle, and it's about normally about 5 centimeters, and it should be flat. It shouldn't be bulging unless the baby's crying really hard. So then I note the back of the posterior side, and that is the fontanelle is a triangular shape, and it is also flat. So then I assess the sutures here. The sutures are palpable. They may be overlapping, and molding may be present. This baby looks like she had a good exit through the birth canal. So there's no evidence of any cephalohematoma or any caput saccoideum. Okay, so then the neck is short and it is thick, and it looks good. If it was webbed, then we would have be noting that could be a chromosomal abnormality. So then I'm looking at the eyes. The eyes are symmetrical. They are equal in size and shape. The spacing of them rules out any abnormalities as well, such as Down syndrome. As far as color goes, the newborn infant's most all newborn infant eye color is gray or blue. So this baby has blue eyes, but we don't know if the baby's going to keep the blue eyes because the color's not finalized till about 1 year. So let's see, I'm going to take the pen light here, and I look for pupillary response and red reflex, and that is a good sign that they are both present. Okay, so the eyeball movement as well is noted, and there are some random jerky movements, which is also a normal thing. So now I'm going to look at the ears. I'm looking at them. They are symmetrical. There are no skin tags here. There's no blockages in there, and the cartilage springs back, and they are firm, and that is good. And if I go like this, then the baby responds because the baby has good hearing. Hearing is well developed at birth. Okay, the nose is midline. Okay, it's flat and it's broad. There's no drainage. And newborns are obligatory nose breathers, so those nares are patent, and that's a good thing. All right, so the next thing we want to do is look at the mouth. So I would be changing my gloves, putting on a fresh pair of gloves, And I will be noting that the lips are symmetrical and there are no lesions. And I would be putting my pinky here, feeling around the soft and hard palate, making sure there's no evidence of any cleft lip or cleft palate. The buccal mucosa is intact and moist. So those are all good things. There might be evidence of Epstein pearls, which are white cysts, and they will disappear within a few weeks. The tongue must not be too protruding or too wide. That can be a sign of chromosomal abnormalities. The gums are also smooth. Sometimes you may have a tooth that is erupting, a newborn tooth. Okay, so we're going to move on to the chest. We're going to look at the chest. We look at the neck's symmetrical, no webbing, and the chest is barrel-shaped, and I'm noticing that the respirations are even, it's diaphragmic, and then the clavicles feel intact, there's no fracturing there. The nipples are prominent. That is also a normal thing. They're well formed. And breast nodules should be approximately about 6 millimeters, which I would be measuring. All right. So then our abdomen is slightly bell-shaped, and the umbilical cord, of course, is intact. There is no odor, there's no drainage, and there is one vein, umbilical vein, and 2 arteries. I will then auscultate the abdomen, and I will listen to all 4 quadrants. And I will notice that there are bowel sounds. And I will listen again later to make sure that because sometimes the bowels are not making too much racket. Okay, and then I'm going to assess the genitalia. This is a female, and the labia major is covering the minor and the clitoris, which is good. And there might be a bloody tinged mucus present, and that is normal, and that is called pseudomenstruation. With note that the hymen tag should be present, which it is. Okay, and then I need to make sure within the next 24 hours that this baby does void. Also, I would be checking the stool, the first meconium, and assessing the meconium. And I also am looking at the anus and making sure that there is that it is present and it is patent and it is not covered by any membranes. I'm going to keep the baby warm, and the baby needs to go back to mom as soon as possible because the mom is breastfeeding, and breastfeeding is the best form of nutrition for a baby, and we would like to see the mom continue to do that. If she has any issues, we would make sure to refer her to consult with a lactation specialist. So the baby's healthy and the baby is happy, and the baby's going to sleep. All done. Thank you.